Your breast is fascinating. It sits on your chest wall and changes throughout your life in response to your hormones and to change during puberty, your period, pregnancy, breastfeeding, and menopause. In this video, we are going to talk about 8 signs on your breast that you should not ignore. But before we proceed, are you able to name all the parts of your breast? Here we have an image. You can see all the parts. Actually, the breast is like a teardrop. The shape is like a teardrop. And that small projection is the nipple. The darker circle around the nipple is areola. And those small bumps that you sometimes see around the areola are oil glands, also known as Montgomery glands. This is the body of the breast and the tail, which point towards the armpit. So the breast actually sits diagonally in this way. And finally, the crease at the bottom where the breast meets the chest wall is called the breast fort. So now we can proceed on 8 signs that you should not ignore. One is inverted nipple. That's when the nipple points inwards, or it can be folded like horizontal crease, and sometimes can be normal. It can be seen commonly for people who has an inverted nipple. For those people, there's nothing to worry about because in some situation it can even come back out. But if you have a normal nipple and you develop a new inverted nipple, you should see your doctor immediately. The other sign is flaky rash. A flaky rash around the nipple or areola may be a sign of an underlying issue. The rash can be itchy, red, sore, cracked. It can spread outward and it can even be whippy. So it can look like nipple eczema, but it may be more than just a skin issue. Tethering. Tethering refers to the pouring in or drawing in of the skin, making it look like there is a dent in the breast, and can be more noticeable when you raise your arms above your head. It could be a sign of underlying problem in the breast. Please don't ignore this. Dimpling. Here, the skin of the breast will have multiple dips and will be looking like a skin on an orange, and it's called spot orange sign. And actually, it happens because thickening and the swelling of the skin, which then accentuate the pores. If you see this change, please get checked. The other sign is feeling unusual warmth in your breast or part of your breast. Could be a sign of something not right, because the warmth can be associated with tenderness or redness. It can sometimes feel like an infection in women who are breastfeeding. It is not uncommon to have a single hot breast which is painful and red, and this is called mastitis. And the most cause of this is bacterial infection, which might even be secondary to breastfeeding, and it is even more concerning if you develop this while you're not breastfeeding. The other sign is nipple discharge, and this means that there is a fluid that's coming out of the nipple, and this can be secondary to various causes, means it can be caused by so many things. It might have many colors. The discharge might have many colors, and those colors can define different underlying causes, which may be yellow, green, milky, white, clear, or even blood stained, and can affect one or both nipples. Sometimes can be spontaneous, means you might be taking off your bra and you see there is some stain inside, or it can come when the nipple is squeezed. Please don't ignore this sign, especially when you're not breastfeeding or when it is coming from one side. The other sign is change in size. Naturally, bodies are symmetric and many women have uneven breast, meaning one side might be bigger or smaller than the other side. Though it might be normal, if one of your breasts suddenly changes the size or shape, don't ignore this. The other sign is breast lump. The lumps are relatively common and can feel different from your normal breast tissue, so they can feel quite firm, hard, smooth, or irregular. And if you try to move them, they can sometimes be mobile or fixed, and it can be quite hard to know if you are feeling a lump, because sometimes breasts are quite lumpy, especially in upper and lower outer parts, and especially in the 2 weeks before your period. So that means that if you want to feel a lump, the best time could be a few days after your period has ended. What you have to notice is that all lumps are not harmful, but if you do find a lump, it is very important that you get it checked out. Again, a persistent lump in the armpit or or around the collarbone. Those and also might be a sign of an underlying problem in the breast. You can look at those signs that you have mentioned to remember that those signs that you have mentioned can even indicate that you have a breast cancer. Please check yourself. If you notice any sign of among those you have talked about, don't panic, but make an appointment to see breast surgeons. If you have learned something new, please leave a comment.